Jersey Hintz from Bismarck Burley Public Health and Dr. Rhonda Schaefer-McLean from Balance Medical are here now to stress the importance of knowing your body. Ladies, welcome back to Studio 701.
Thank you. Hey, thanks so much.
It's a pleasure to have you, ladies. One thing that we want to ask is, why is it important to pay attention to what is normal for your body?
One of the biggest ways that we can help out with our long-term health and what our medical team is trying to do is just to kind of be aware. Where are we with items that we know are routine screeners? Where are we with exercise and body weight and all things that we know to be healthy? And what's our responsibility as a person and a patient for reporting those things so that we can get the proper interface and the proper assistance.
Mm-hmm. And ladies, we are here specifically talking about ladies' health here today. And so we want to talk about some signs and symptoms of what it comes for when it comes to breast cancer and cervical cancer. Jersey, can you tell us a little bit about that?
Yeah, so one of the things with the Women's Way program, when we talk to women who call into our program to kind of seek out some help with questions on what to do, we always make sure that if they are finding any type of lump, any type of nipple discharge, anything in their breast that was not there before, that is there now, discoloration, rash, anything like that, really important to get it checked out. It could be something, or it could be breast cancer. So we really want that checked out by a doctor. Anything out of the ordinary is something that we want to refer into a provider to have checked.
Mm-hmm. Definitely. And Dr. Rhonda, we're talking about breast cancer and cervical cancer. So are there any signs and symptoms that we should look out for when it comes to cervical cancer?
Cervical cancer is probably a lot more difficult for us to pick up until it's to the advanced stages. Certainly if there's a significant, discharge or odor, those are things that absolutely warrant someone to take a medical assessment of. But prior to that, there are multiple phases. Cervical cancer doesn't just develop overnight. We think that it probably comes to folks over, probably a 2 or 3 to 7 year period. For most people, it probably stretches out to 7 between the first abnormal pap and then, wow, it's progressed to cancer. So there's quite a bit of time there typically to pick it up unless it's a very, very aggressive strain. And all of those years preceding, for the most part, it's really quite silent. So that's when you really just need some assistance to pick up.
Mm-hmm.
And Dr. Rhonda, again, I just want to ask, when it comes to cervical cancer, I know that pap smears are, it's something that kind of detects whether someone has cervical cancer or not. Is there another way to detect cervical cancer, or is this the only one?
Well, really, we use pap smears. It's sort of developed itself into something a little bit different over the years. Previously, preceding maybe 10 plus years ago, we really looked mostly at the cells of the cervix, and so we called it, this typical scraping. And in the past 10 to 15 years, we've added a lot more of a mainstream assessment of HPV. And so HPV is a human papilloma virus, and so it's a virus like we get for our lungs during cold and flu season. We can get that to our cervix from intimate interactions, and that virus actually is the culprit that leads to cervical cancer.
Wow.
And so we can detect that virus, and it turns out that our ability to detect virus is getting higher and higher and higher, and it's starting to supersede our ability to look at cells and say, that's just an irritated cell versus a precancer cell. And so when we use those two things in concert, that's where we find that we're able to get to the highest level of sensitivity and specificity as far as picking it up and being certain that what we're picking up is actually what we're looking for. So yes and no is a straight answer to your question, but I hope that helps to kind of outline it.
Definitely, lots of services out there to help prevent is the key word here, right?
Yeah.
Mm-hmm.
And ladies, we got just a little bit of time left, but we're talking about taking care of our body, paying attention to what's going on. So it's easy for us to just look online. We got some symptoms, we look online, and it gives us this gamut of lists of what's going on. Should we be doing that, or should we just go straight to a doctor to check out what's going on with our bodies? Any thoughts about that?
Yeah, some research online is perfectly fine, and we all do it. I think Dr. Rhonda would probably agree that really consulting with a professional is really your best bet if you find something that is concerning to you and something that just wasn't there before, that's a new symptom. Give us a call at Women's Way. We can help you work through, do you qualify? Can we help you financially? It can be expensive to seek medical care sometimes, so we can help you. We can refer you to really good physicians like Dr. Rhonda here through UND and Balance, two of our participating clinics, and we can help you get that assessment. So, whether you research it online, that's fine, but please give us a call and seek out some professional treatment.
Will do. Well, thank you so much, Circe and Dr. Rhonda, for coming on our show again. It's always a pleasure to have you here.
Thanks so much.
Thank you.
And everyone at home can learn more about the Women's Way. Please visit health.nd.gov/women's-way or call them up at 800-449-6636.